Hi, folks. My name is Josh. I'm one of the clinicians with Addiction Services of Thames Valley, and welcome to Addiction Services Supportive Information Sessions. Before I get started, I'm going to do a little bit of housekeeping. As a result of COVID-19, we've had to adjust some of our services. At this particular point in time, we are providing services via telephone and potentially some other platforms. If you are in need of contacting us for any number of reasons, we can be reached between 10 a.m. and 3 p.m. at 519-673-3242 extension 230. You'll notice that there are a number of options. If you are looking for general information about services or intake support because you are a new client, we would encourage you to contact extension 222. If you're a current client looking to connect or looking for further intake support as a result of maybe not being sure about accessing your particular counselor, extension 284. If you are a family member presenting as a result of concerns with a loved one or someone close to you and their substance use concern, you would contact extension 221. And if you are concerned about any potential withdrawal risks for yourself or are interested in accessing the RAM clinics, which is rapid access to addiction medicine clinics, these would be things like naltrexone, naloxone, Suboxone, and methadone. You can contact extension 281. At this particular point in time, we are experiencing a lot of, I think, stress in general as a result of COVID-19, but we also know that addictions and mental health can be pretty impactful on individuals. And what we realize is that you may need additional supports outside of the serviceable hours that we provide. There is the Reach Out program, and they provide addictions, mental health, and crisis supports. They can be reached 24 hours a day, 7 days a week. At toll-free 1-866-933-2023, or if you have access to the internet, they can be reached at reachout247.ca. In addition, if you are feeling stressed or anxious and your preference is to kind of work with online resources, there is the option of using the Bounce Back program. You'll notice that that is in the bottom right-hand corner. So please be aware that there are numerous resources available to you. They are either a telephone or a mouse click away. We also want to take a little bit of time just to kind of talk about COVID-19 and taking some basics, healthy precautions to protect you and those people around you, given that COVID-19 is a new illness that we are aware can affect your lungs and airways. It's important to take the time to practice good hygiene. One of the most basic steps that you can take is washing your hands. What that should look like is using soap and water for at least 20 seconds and or using hand sanitizer. If your hands aren't already covered in dirt, wash them first. We also are encouraging people to stay at least 2 meters or 6 feet apart. As kind of a Canadian standard, they suggest that a hockey stick at arm's length is about 6 feet. If you are sick, they're encouraging you to stay home. Where possible, staying home will reduce the risk of transmitting to other people. And last but not least, if you are concerned that you do have some symptoms or are experiencing or have experienced exposure to it, there are free assessment tools online. In this case, bottom right-hand corner here, you would potentially click on canada.ca, and they do have a link that would allow you to do a self-assessment. At the end of that self-assessment, it will let you know whether you should be taking further steps, and it'll walk you through those particular steps. So before we get into the actual topic today, what we want to do is just take maybe a minute to do a little bit of a grounding exercise. One of the ones that I like is called the belly breathing or toddler breathing. Very simply, what it allows us to do is to kind of do a quick assessment on our breathing and make some take some steps to find ourselves in a bit of a more relaxed state. Very simply, what I'd encourage you to do is, if you're sitting at this particular point, is to kind of get comfortably leaned back in your chair, feet flat on the floor, in a relaxed position. Usually, what you'll find is your knees will kind of open to about a shoulder width position. And then what I'd encourage you to do is take your thumb and pinky finger and extend them like this. And what we want to do is we want your pinky finger to find your belly button, and then the top of your thumb to find your solar plexus. If you're not sure what the solar plexus is, it's that tender spot where your rib cage comes together. If you push on it a little bit, it can be uncomfortable. We don't want you pushing on it and being uncomfortable. We just want you to find that. So pinky on the belly button and thumb to the solar plexus. And really all this exercise is an effort to breathe deeply. By our nature, by the time we're adults, we have a tendency not to be very relaxed in our breathing. We tend to shortchange ourselves in short, choppy breaths. What we want to do is much more relaxed. And part of the reason we call it belly breathing or toddler breathing is if you've ever seen a toddler, for example, running around, they're great breathers. One of the things that they do, you'll notice that their bellies just extend out and stick out. And as we grow older, as adults, we have a tendency not to like people seeing our bellies. Personally, I don't really care about that, but what I'd encourage you to do is consider that your diaphragm actually, which is the muscle that pulls your lungs down to allow them to expand, doesn't just go up and down. What it does is it actually goes in a bit of a J pattern. So as you breathe out, the muscle kind of drops down and pushes out. So what we want to be able to do is allow that muscle to do exactly what it's supposed to do. So what I'm encouraging you to do is when you take a deep breath in, you're going to do it through the nose. So and you're really just going to let your belly relax. Let it fall forward so that you actually kind of get a bit of an exposed tummy. And then hold it for half a sec at the end, and then let it out. So in through the nose, relax the belly, out through the mouth. So and what I'll get you to do is I'm going to get you to do that 3 or 4 times, maybe 5 times. Just take your time. Remembering to relax that stomach muscle, allow it to come out. No one can see anyway, we're doing this online. And when you're ready, just come back to us. Some of you may feel a little lightheaded as a result of doing that exercise. That lightheadedness isn't necessarily a bad thing. What it really means is that you've infused oxygen into your blood and it's getting into your brain. If you're lightheaded, it probably means that you've been shortchanging your breath a little bit. So what I'd encourage you to do throughout the day, and you don't have to do the pinky and thumb, that is just an exercise to help you recognize that as your pinky goes out, you're doing the job right, is throughout the day, do that a few times, 4 or 5 in outs. Remember, again, through the nose, stop and hold it for a second or 2 at the top of it, and then let it out through the mouth. Alrighty. So today's topic is on coping and withdrawal. And to give it some history, part of the reason that we do SIS groups is that as demand for service went up at Addiction Services of Thames Valley, what we found is our wait lists were getting a little bit longer and longer, and we wanted to address that. So we had a conversation about what are some of the most common topics that we provide on a one-to-one basis in counseling, and we came up with a number of presentations or topics rather that we all talk about, and we thought, hey, why don't we provide it as in a group setting, and that way we can see more people more often, get more people into the organization. And withdrawal is one of those ones that is a very common experience with a lot of different people. The flip side of that is that we know that there's a lot of myths associated with withdrawal, and we want to be able to challenge some of those myths and allow people to understand that there are experiences that you're going to have, but they may not be as serious as you thought, or it may be a little bit more serious than you thought it may have been. So what we want to start with is a definition of withdrawal. Little cartoon there on the side. The reality is that withdrawal is a physical, emotional condition that results from the abrupt discontinuation of a inducing substance characterized by flu-like symptoms. Really, if we want to kind of put this in very simple terms, what it means is that we feel ill when we stop using a substance that our bodies and brains have become accustomed to having. Now, the reality is that most of us have already experienced the flu. So when we talk about the flu, we are talking about a lot of physical symptoms. So withdrawal can sometimes look like the flu. And in fact, on occasion, I've had clients in my years of doing this work who have said to me, you know, Josh, I've never had withdrawal problems, but the reality is I think my substance use causes me to be a little immune depressed, and so when I stop using, I tend to get flus or illnesses. Reality is that it is most likely a withdrawal syndrome that the person is experiencing. So we start with the physical side of things. And we look at things like sweating and rapid pulse. So those are the tendencies. You kind of feel sweaty. There's usually a sheen on the skin. We do also experience things that are called tremors or seizures. Now, what I need to do is I need to separate these two things out, because tremors are not seizures, but seizures can start with tremors. So a tremor really is just kind of that kind of vibration feeling, for example, the hand shaking or that sense of shakiness within the body. What a seizure is typically a loss of consciousness. Most people don't realize that they've had a seizure until they are coming out of it, and usually they're extremely fatigued. They may have lost control of bodily function, and they may have fallen to the floor in most cases. There is an uncontrolled movement in the body that a person isn't aware of. We'll talk a little bit more about seizures as we go, but again, they tend to be much less, they occur much less often than tremors, but can be a dangerous aspect of withdrawal. We also have a tendency to experience insomnia in withdrawal, and that's an inability to kind of fall asleep or stay asleep. Nausea or vomiting, physical agitation. So that's just that kind of an inability to sit still. People may get up and kind of walk around, or it just feels better when we're moving. We may feel a need to kind of clench and unclench fists or flex muscles, those kind of things. Hot and cold flashes, so temperature variations, often kind of coincide with the sweating and the rapid pulse. We also may experience muscle pain or muscle aches. A lot of people will talk about the kind of the larger muscles in their thighs aching, which may also kind of lead to that physical agitation. It feels better when we're actively moving. There's also diarrhea that may occur, a physical fatigue that can be quite profound, watery eyes, runny nose, more than usual. Some people just naturally have more watery eyes or runny nose, but we're looking at more than usual. So the last is shortness of breath. Now, this is not an exhaustive list. Some people do experience other physical symptoms, but these are some of the most common ones. And again, if you've ever experienced the flu, then you've experienced some of these symptoms. A couple things to consider is that not everybody who goes into withdrawal experiences all these symptoms, and some people that go into withdrawal will experience all of them. I think it's important to draw your attention to a couple of things. We look at sweating, vomiting, diarrhea, watery eyes. These are all things that involve hydration of the body. And so I want you to kind of remember that, because later on we're going to be talking about some of the strategies to help reduce withdrawal or manage withdrawal symptoms. And hydration becomes a very important aspect of this. Now, when we start to separate out the withdrawal from flu-like symptoms, we move on to the emotional or mental side of things. The interesting aspect of withdrawal is that there is a tendency to start experiencing negative or unpleasant mental and emotional experiences. So it's not uncommon that people in the early stages of withdrawal will experience things like depression. Now, the depression may be brought on by the change in the chemical or the removal of the substance from your chemicals in your brain, or the removal of substances from your body. But it also may just be that there is an underlying mental health condition like depression that's starting to present itself more obviously in the absence of drugs or alcohol. There's often an intense craving for the drug. Now, I've had people share with me and say, Josh, you know, you should have the intense craving for the drug on the physical side of things. However, in most cases, the intensity of craving for drug, while it does feel like it's physical, tends to be much more mental and emotional. There's often an extreme fatigue that can be associated with this. And I've had people say, well, Josh, why do we have fatigue physically and fatigue mentally? Because it is quite possible to experience and not have a physical fatigue associated with withdrawal, but also have a mental fatigue. And the reason for this may be is that when you're actively using substances, one of the things that you may be doing is trying to demonstrate to people that everything is okay in your life. Your job's okay, your relationships are okay, your finances are okay, your health is okay. And it's almost like a juggling act. When we stop using substances, really what we've done is we've let those kind of balls drop, and we become aware of how exhausting actually trying to maintain some sense of normalcy, or the illusion that things are okay in your life, and how tiring that aspect can actually be. The other piece too is that some people do experience anxiety. Angry outbursts is another one. Now, these aren't necessarily definitive experiences people will have, but they're not uncommon. And part of the reason is that drugs and alcohol can act as kind of a manager for emotional situations. When we're stressed or anxious, upset, angry, we may use drugs to moderate those emotions. So when we stop using substances, we've lost one of those mechanisms that help us manage emotions. So all of a sudden, they tend to grow outside of our ability to manage them, and that's where those outbursts come from. We also see sometimes a lack of motivation, and that sometimes just lasts for a couple of days, can last longer, and may be related to depression, irritability, and apathy. Now I'm going to circle back to delirium tremens, and these are, or sometimes known as DTs. These are, a DT is a condition that results when certain neurotransmitters in the brain are impacted by our substance use and the withdrawal from those. Those typically tend to present as auditory or visual hallucinations. So if you've ever had the experience or witnessed somebody having the experience of stopping their alcohol use, for example, and it feels like there's bugs crawling on their skin, or that the walls in their room are breathing, that is likely a DT. Now, one of the things that we do know is DTs tend to happen in the absence, or can happen in the absence of seizures. But if a person is experiencing DTs, there is an increased risk of seizures associated with that. So one of the things I think it's important to say is, before entering into any form of withdrawal, it is probably best for you to reach out to a medical professional. One of the things that we do have access to through the agency is our CWSP program, or Community Withdrawal Support Program, which is something that if you are calling into the organization, or you do actively have a one-to-one counselor, would be to talk to them about that, although they've likely already brought that up if they suspect that there's a potential withdrawal risk for you. So one of the questions that people often ask is, how long am I going to feel this way? And this is where it starts to break down a little bit, because there are a lot of variables that impact on a person's ability to manage within their withdrawal. So we have to look at things like the type of substance. Different substances tend to have different impacts on the body, which means that they have different impacts on withdrawal symptoms. We also have to kind of look at the quantity of regular use, the length of time that a person's been using the substances or abusing substances. The other thing too is that we have to kind of consider the different substances have different effects. So things like alcohol, withdrawal experiences in alcohol are different than withdrawal experiences in cocaine. We also have to kind of respect that gender differences are really important to look at. So a good example of how long these symptoms will last, we can start looking at individual substances. For example, um, when a person's drinking alcohol, we have a pretty good idea of what they're consuming and what quantity and how that will impact them. And part of the reason we know that is because alcohol is a highly controlled substance in the province. We know that at 40 ounces, or sorry, at 40% alcohol, a 26-ounce bottle is just slightly shy of 17 standard drinks. We know that a 12-ounce bottle of beer at 5% is considered a standard drink. We start to get into trouble when we talk about things like moonshine or high proof alcohols, which aren't as common. We also know that things like opiates, for example, the way we consume them change the standard. For example, people often start opiate use through prescription as a result of some sort of pain issue that they may have. Well, we are provided medications like Percocets or OxyContin on an oral basis. And some of those oral painkillers, for example, are what are referred to as SRs or XRs, or slow release or extended release tablets. They're supposed to be consumed as a full tablet, but if the substance use is escalating and there's a dependency developing, it's not uncommon that the first step is that people bite down on that product, and that means that they destroy the slow release makeup of the tablet, and the drug gets into their system faster. Well, beyond that, then it's not uncommon that people may crush the tablets, snort the tablets, and then an escalation is to smoking or injecting. Each of these steps tend to have a different impact on the withdrawal symptoms that a person may experience. The flip side of that is cocaine has a very different withdrawal experience, and there are fewer risks associated with it. In most cases, what happens is after using for a lengthy period of time, either our ability to purchase the cocaine runs out, or our ability of our body to continue to use it just kind of hits a wall. And individuals who experience that will typically kind of, and I'm simplifying it, but they'll tend to go to bed, sleep for 24 hours, wake up, start eating food, and then they start typically feeling better. We also know that women actually metabolize alcohol, for example, at about a 1/3 slower rate than men, even if they're the same body weight. But we do know that men tend to be heavier than women in general and larger than women. So difficulty starts to express itself when men and women are together consuming alcohol in the same pattern, because we tend to consume alcohol socially like the people around us. So you can imagine myself at 220 pounds, if I were consuming alcohol with a woman at 135 pounds, she's going to become intoxicated much faster and potentially stays intoxicated much longer than me because of her ability to metabolize alcohol. We also know that different people just have generally different responses to substances. I can share a couple of stories from my time working with individuals. The first one is that I go back probably about 20 years ago when I was very early in my career, and I was working with an older gentleman. I think he was in his mid-70s at the time. And he had spent about 20 years drinking scotch, and he would consume roughly a 26-ounce bottle of scotch every day, which is, like I said earlier, about 17 standard drinks. And everything in my experience and my education suggested that this individual should not withdraw without medical support. And I told him this. I expressed to him some options. I encouraged him to speak to his family doctor first. I encouraged him to consider going to the Withdrawal Management Center. At the time, we referred to it as detox. And he refused. He came back to see me a couple of weeks later and shared that he hadn't consumed alcohol in, I think it was like 13 days. And I said, great, what resource did you use? He says, I didn't. And I said, oh, how was that? And he said, I couldn't sleep for a night or two. And he goes, my stomach was really upset, had a little bit of diarrhea, but otherwise I was fine. So the, individual kind of tolerance and individual kind of physical fortitude on individuals has a different impact for people. I had another gentleman who at the time was in his mid-30s, I believe. And he was coming to see me because every time he consumed alcohol, and in his case, he would drink 2 or 3 light beers, maybe once a month, maybe twice a month, on kind of during the summer, and he would have a seizure within 24 hours of using his substance or using his alcohol. Now, the reality is if you reflect on the moderate guidelines in the province of Ontario, they recommend consuming alcohol no more, for a man, no more than 2 to 3 standard drinks. This guy was drinking, 2 to 3 light beers, which means he was well within moderate guidelines, and he was still, but he was having seizures. So technically, he didn't meet the criteria for an addiction. But why he was coming to see us is he was really struggling with the idea that he could not consume alcohol because it had a negative impact on his health. So those are just 2 examples of how some of these variables impact differently on people. So this tends to lead to the question of how often or how long will these particular symptoms last? What we can say is, as a general rule, we talk about it being a tent, 2 to 3 days up, and then 2 to 3 days back down the other side. And why do we do that is because we have a lot of people who will have likely attempted to make change several times before coming to see us. And they've shared with us and they say, listen, I get 2 or 3 days into this and then I just get uncomfortable. And I know, unfortunately, that when I consume my substance of choice or my drug of choice, the symptoms go away. So what we encourage people to do is consider that day 3 is usually, like day 2 into day 3 is usually the worst of it. And then if you can get through that, coming down the other side. And we've had plenty of people come back and say, Josh, I wasn't really uncomfortable starting into the 3rd day, but I remember what you said. And as a result of that, the reality is that I knew that things were going to get better, and lo and behold, when I got up the next day, I was starting to kind of come down the other side of that. Now, that is a general kind of rule, as we said, the tenting, but different substances have different effects. As I said earlier, excuse me. As I said earlier, different substances have different effects. Like I said earlier with cocaine, there isn't a very significant physiological withdrawal. Again, people tend to have a tendency to kind of climb into bed, fall asleep, sleep, copious amounts, wake up, they're hungry, they eat, and they start to feel better. The difficulty with cocaine is that there's often a very kind of strong psychological dependency and that desire to kind of feel better because we use dopamine quite significantly while we're on cocaine. And dopamine is the drug that allows us to kind of feel pleasure with things like eating and exercising and laughing and sex. So as a result, we tend not to experience as much joy and pleasure, at least early in the recovery process. And therefore, people feel kind of a drive to return to the cocaine use. Now, opiates is a completely different story. It is not a tent in most cases. It's kind of more like an awning. And what I mean by that is that the withdrawal symptoms don't kind of gradually increase with opiates. They tend to go straight up. And people have shared that within several hours of their drug wearing off, what they tend to see is they kind of see this rapid escalation of physiological symptoms, the sweating, the nausea, the joint pain, the muscle aches, and it escalates quite rapidly. But then, like an awning, it's not a teepee shape, it's more of kind of a straight line or very tapered line kind of coming down over a lengthier period of time. So with opiates, those symptoms can last for several days, and in some instances up to and including a couple of weeks. So understanding, of course, that everybody is a little bit different in terms of the experience that they'll have. There is also something called post-acute withdrawal. Now, what post-acute withdrawal is a longer-term, or rather, it's a cluster of longer-term symptoms that occur anywhere from weeks to months after, and in very rare cases, it may last over a year. But they tend to be milder, more cognitive or psychological symptoms. So things like coordination, memory, emotional regulation are impacted. So just bear in mind that everybody's different and everybody's withdrawal symptoms can be a little different. Um, so what this particular chart is just kind of helping us identify some of those differences, and I'll walk you through how to read this particular chart. Now, I need you to understand a couple of things about this chart. This chart was developed, or this presentation was developed about 12 years ago, so this chart is a little outdated. Now, the consistency of the substances are still relatively consistent. What it is missing is crystal methamphetamines, but we can look at it from the perspective of stimulants. So the way to read this is the chart works left to right. So the first line that you typically see here, or the fainter line, is the level of dependency that the substance impacts. And what that means is generally how addicted you become to this particular substance and the need to continue to have it in you. So you'll notice in this particular instance that nicotine is the highest there. Next is the second line in, which is the darker gray, is the withdrawal. What that is the intensity of the withdrawal symptoms when we stop using this particular substance. Beyond that, the next line or the middle line there is the level of tolerance. What that means is how much I need in order to get the same effect. And then after that, the second last line or the darkest line in there is the reinforcement. Now, what reinforcement is the how often you have to take the particular substance in order to get the desired effect. So what we tend to do is we tend to focus on cocaine here, for example, in comparison to alcohol. If you've consumed alcohol before, which most of us have in North America, we know that once we get a level of alcohol in us, what we tend to do is not have to continue to constantly drink the alcohol, because our body, it gets in and it stays in our system and our bodies metabolize it out slowly. Whereas cocaine has what's referred to as a very short half-life. And what a half-life is, and all the medications we've ever taken have half-lives, it's how long there's a positive effect within the body before we require more of it. And cocaine's half-life is very short. So if you've ever used cocaine, you know that depending on the quality of the cocaine, the intensity of the high is only kind of a 15-20 minute process. So then what happens is our brain comes knocking and expects more of the drug within that time frame. So we have to constantly kind of re-up with cocaine or reinforce with the cocaine to get the desired high. And then the last line there on the outer right of each of these is the level of intoxication that impacts on the individual. So how obvious the intoxication and how intense the intoxication is for the individual. So a couple things to consider when we're looking at these. If you are looking at this and saying, well, why aren't Oxycontins or Dilaudid or fentanyl on here? Excuse me. I would encourage you to look at heroin. The difference between OxyContin and heroin in very simple terms is heroin is a real product, meaning it comes directly from the plant, whereas things like fentanyl are synthetic. So I always say, real cheese versus cheese whiz. A couple of things to consider are, or surprising that a lot of people suggest are, when we look at nicotine, for example, and the level of dependency, people are like, wow, I see how, nicotine has one of the highest levels of dependency, even higher than an opiate, for example, like heroin, an opiate like heroin, or opioid like Oxycontins. The other piece to consider is when we look at the withdrawal effect of opiates or heroin, for example, it's not the most severe withdrawal risk. And so that's a common misconception, is that if you withdraw from opiates, you're at risk of dying. Now, there is a risk with there are always risks in withdrawing from any substance, but in a relatively healthy individual with no pre-existing conditions, opiate withdrawal can be incredibly uncomfortable and incredibly painful, but is not generally putting healthy individuals at risk. Alcohol, on the other hand, you'll notice that the withdrawal effect is right up to the top there. And what this really means is that if you are using alcohol on a regular basis at high quantities, your risk of severe withdrawal symptoms, and I'll bring us back to the earlier conversation around seizures, is increased. And this is why we recommend that before entering into any kind of substance withdrawal, it's best to get medical advice. And again, I would direct you back to your family physician, or potentially the community withdrawal support program that we offer here at Addiction Services Thames Valley. Again, there's also the RAM clinic, which is the Rapid Access to Addiction Medicine, where you would have access to things like, for opiates, Suboxone and methadone, and for alcohol, we do have medications like naltrexone, not to be confused with naloxone, which is for opiates. Naltrexone is a medication that tends to reduce the desire to consume alcohol over a period of time. You have those options to support you. One of the other things that people often kind of are surprised by are the level of dependency, withdrawal, and tolerance to things like caffeine. For some reason, I always find it ironic that I'm sitting here doing this presentation and I've got a cup of Tim Hortons with me, but we do like our caffeine in North America. So the last one that I would point out, and a lot of people are shocked by this, and I would myself challenge this particular chart, is the level of intoxication that is expressed related to marijuana. One of the things that we do know is in the last number of years, the content and how we consume marijuana has increased the potency of the drug that we have access to. If we reflected back to, say, for example, my parents, who are in their mid-late 60s, so they would have been using marijuana, or their generation rather would have been using marijuana back in probably the early mid-70s. The content of THC in those particular joints, or that particular strain, was somewhere between 2 and 4%, maybe 5 as on the high end of things. And if we look at the OCS, or the Ontario Cannabis Store, the highest content I believe that they sell is 28%. So what we really need to do is kind of express a little bit of concern there and say, imagine, for example, you're a 19-year-old who, or you're just turning 19 and you've never experienced marijuana before. That's probably a rarity this day and age, but I mean, for the sake of the conversation, you decide to go on and order some marijuana because it is now your right and to do so. You order the 28% and you smoke that for the first time. You start to get a better understanding of how the impact that can impact an individual negatively. So when they talk about any substance, especially marijuana, the term slow and low, or low and slow rather, is one of the most important things. That being said, also kind of expressing concern around edibles. What we do know is that edibles are a much different drug than smoking marijuana, partially because of the delayed response. And the reality is that there are some inconsistencies in controlling the amount of THC in the product. So the recommendation, if you are using or planning on using edibles for the first time, would be maintaining no more than 5 milligrams on your first experience. So what this leads us to is then, and I hope that what I've shared with you so far gives you kind of a basic understanding of how withdrawal impacts on an individual, and that it normalizes maybe some of the experiences that you've had. It also gives you some direction to speak to professionals before making changes, but also knowing that the reality is that you can make changes, and that while it is uncomfortable, that there are some strategies that can support you in staying sober longer term. So that's what we're going to kind of step into now, is some basic strategies on reducing the impact of withdrawal in your day-to-day functioning. And this is probably the only time you're going to hear someone say this, is the benefit of withdrawal, which sounds ridiculous, but it's not like the flu. With the flu, you wake up in the middle of the night, you're violently ill, and you say, okay, I have the flu. I had no, I don't have any control over this. When we talk about withdrawal, you can pre-plan, and that's what we encourage you to do, is pre-plan and stock up. So knowing that you may be experiencing withdrawal for upwards of 72 hours or more, what we encourage you to do is stock up on comforts. So ensuring that you have adequate foods and fluids, medicines to support managing withdrawal symptoms. Now, that being said, as a clinician, I'm not a medication first kind of person, but we know that there are a couple of medications that may be beneficial for you. What we need to understand is most of what we experience in withdrawal is an inflammatory response. So ibuprofen, for example, is a systemic anti-inflammatory or a non-steroidal anti-inflammatory. So it does reduce inflammation in the body. The difficulty with ibuprofen is that it can upset the digestive tract. So if we go back to withdrawal symptoms that we talked about earlier, nausea, heartburn, indigestion, upset stomach, diarrhea, these are all things that affect us on a regular basis. So if we're putting ibuprofen in there, it can exacerbate those particular symptoms. Now, that being said, you heard me say it: nausea, heartburn, indigestion, upset stomach, diarrhea. The easy one is this is Pepto-Bismol. So what you may want to do is, if you are bringing medications in to support your withdrawal, ibuprofen and Pepto-Bismol should be two medications that you do have on hand that may support you. The nice thing also about ibuprofen and Pepto-Bismol is neither of these are habit-forming medications. The other thing that you're going to want to do is ensure that you have things that are stimulating and entertaining for you. Me personally, I'm a reader. I love losing myself in a good book, but that may not be your thing. So things like music or movies, Sudokus, crosswords, magazines, maybe things to consider. You can actually get these all as apps on your phone now. The nice thing, or one of my favorite stories related to kind of the pre-planning, is I had a client that I've worked with off and on for since the mid-90s, and I started seeing him in my capacity at Addiction Services and in the early 2000s, and he after years of struggling, he came and he said, listen, I need your support for relapse prevention. I've already made the changes. And I said, oh, what did you do that was so successful? And he had shared that the whole 72-hour rule around withdrawal was really important for him to hear. And what he had done is locked himself in his ensuite with some fluids and foods, but also, in his bedroom with an ensuite rather. But he had also grabbed rented the Lord of the Rings and the Matrix trilogies and watched the director's edition. He said, believe it or not, Josh, there's probably close to 36 to 48 hours worth of viewing when you go through them that way. We had a good chuckle about that, but that's what worked for him. So finding things that keep you stimulated are going to be really important, because we know if you're just kind of staring at the ceiling, then what you have a tendency to do is hyper-focus on the symptoms. The other thing that we want to focus on is reducing stress levels. Now, I always say to you, if you've ever been told by a counselor or a doctor or somebody in the helping field that you need to eliminate stress, take it with a grain of salt. It's nearly impossible to completely eliminate stress from our lives. The reality is that we have a lot of responsibilities, parenting, jobs, health, wellness, recovery, all these things that do naturally create anxiety and stress for us. What we want to do is reduce stress to manageable levels. And what we know is that stress can make withdrawal feel worse. So one of the first steps that we encourage you to do is be someplace which feels safe and familiar. Home is one of those places, although I appreciate that home isn't always a safe place for everybody. You may be in a co-using relationship. So it's important for you to be able to leave that environment. London does have a withdrawal management center. I'm not going to lie to you, it is not the Hilton. It is a withdrawal management facility. It is staffed 24 hours a day with individuals who are trained to support you get through the withdrawal. It is non-medical, meaning that you will not be provided medications to reduce those risks. We do have a couple of medical detoxes, publicly accessible medical detoxes in the province of Ontario. There are some private ones as well. But a lot of people don't have the funds to be able to support or afford those. So talk to your counselor about withdrawal management if you feel a need to be away from your home in order to get off your substance. The other thing too is take a hot bath. What we recommend at that particular point would be using Epsom salts. The nice thing about an Epsom salt a hot bath with Epsom salt is when we sweat, we are actually detoxing the body. So remember to hydrate very clearly if you're in a hot bath. But the Epsom salts also do two things. They help increase the detox of the body, and it increases buoyancy in the bathtub, meaning that you're less, you're a little bit more floaty, for lack of a better term, and there's less pressure points in the tub. So it gives you an opportunity to manage muscle pain and tension. The other thing too is to clear your schedule. Typically, we don't go to work when we have the flu. Treat yourself well. Don't go to work if you're in withdrawal. You're probably going to be a little crusty, irritable, and uncomfortable. So if you have the ability, the planning aspect comes in. If you've got a long weekend coming up, for example, plan it around that, because then you're guaranteed at least 3 days to kind of go through that. Go easy on yourself. The reality is that you need to cut yourself some slack. In my entire history of doing this kind of work, what I've often found is that the person who is hardest on somebody with substance use concerns is the person with the substance use concern. Treat yourself with some respect. Nobody in the history of mankind woke up one morning and thought to themselves, today's a good day to get hooked on alcohol, cannabis, cocaine, opiates. There are too many variables, but you're taking the time to look after yourself now. Give yourself credit for that and go easy on yourself. Eating and nutrition, very important in the recovery process, in the withdrawal process. Now, I appreciate if we went all the way back to all those symptoms, the nausea, the vomiting, the upset stomach, the diarrhea, you're probably not feeling a need to eat, but I really need to encourage you to get something into your system. One of the wonders of the human body is that it repairs itself. And one of the wonders of your liver, which is probably one of the most involved organs in the use of drugs and alcohol, is that it's one of the few organs that has the ability to actually repair itself. But it can't do it without good nutrition. It can't do it without the building blocks that would allow it. So what we encourage you is to consume light, easy to digest foods. Soup is one of those things. Comfort foods is another one. Now I'm going to contradict myself right now, because I say go ahead and focus on comfort foods, but then the next thing I'm going to say is avoid sugary, carbonated, acidic fluids, spicy, salty foods. These can irritate your stomach and bowels. If I were doing this presentation live, I'd ask people to share what your comfort foods are. I know my comfort foods are basically anything spicy and anything salty, which is probably the last thing that I should put into my body if I were in withdrawal. The other thing too is people often talk about the desire to eat sugar. The problem is sugar is an inflammatory agent in the human body. So what we want to do is try to keep those to a minimum. I'm always going to say, if it comes down to eating nothing or eating a bag of jubes, as long as there isn't an underlying health condition like diabetes, go ahead and eat the jubes. It's better to have something in your system than not. One of the other ones that you may want to consider is meal replacement shakes. The science of them has gotten better. They are a little bit tastier. Trust me, I have personal experience with those. There's a number of different flavors, and temporarily they do provide the vitamins, nutrients, hydration, and calories that you would need in order, and they're very easy to digest in order to allow you to improve your health and wellness. I've had some people challenge me and say, Josh, those things are really damn expensive. What I would challenge back is probably far cheaper than your substance of choice. How much do you spend on that? So sometimes it's just that cost benefit analysis. While you're sober and you become acutely aware of your expenses, what's going to be more beneficial, your sobriety and your ability to work and earn more, or the active use and the spending. So where possible, eat what you can, when you can. Now, a lot of people have said historically to me, well, Josh, I want to get my life on a better path. I want to eat healthier. What's the best way to do it? And there are any number of diets, for example, on the market, keto, paleo, Atkins, vegan, vegetarian. It's hard to kind of find one that is, perfect for the individual. I do have a peer that works for, I believe it's McMaster University athletics department, and or kinesiology, I can't remember, my apologies, but he said one of the best and he's a dietitian, and he says one of the best ways to help people understand what's appropriate is apply the rule of, if it doesn't come that way, don't eat it. So basically, fresh fruits, fresh vegetables, non-processed meats are probably the best bet for you. He said, in terms of kind of respecting what you shouldn't eat, he said there's no such thing as a shake and bake chicken ranch. There's no such thing as a Coca-Cola spring. So if it doesn't exist that way in nature, try not to consume it. I always joke and challenge him on sugar. And he says, well, one of the easiest ways to get around the sugar is, use honey or just learn to go without sugars. That's up to our individual needs. But, any change towards improving nutrition will have a positive effect on us in general. Now, the other piece too, and I'm going to circle back, I said we'd circle back to it because when we started this conversation, we talked a little about the nature of withdrawal and how it can be very dehydrating for individuals. So a very strong focus on hydration is going to be very important very early in this process, and then throughout, just for general health. You're sweating, diarrhea, vomiting, these are all things that remove fluids from your body. So what do we want to do? We really want to drink lots of water. Now, I think what's really important is dispelling that myth about 8-ounce glasses of water a day. Reality is some of us need less than that, some of us need more than that. It depends on a lot of variables: age, gender, body weight, activity levels. The nice thing about water is that it's a hydrator and a detoxifier, which means when it goes into your system, it kind of gathers up some of the byproducts of living and detoxing from your kidneys and liver, and then it removes those byproducts when we urinate or when we sweat. A lot of people said, well, what about other fluids, Josh? Sports drinks are okay in small quantities. We have to remember that sports drinks have a lot of sodium in them in most cases, which is what allows them to hydrate. So if you're having, a rapid heart rate or high blood pressure as a result of your withdrawal, we want to be careful about how much sodium we put in our system. So we always come back to water. Why? Because the human body is designed typically for only 2 fluids in its entire lifetime. As infants, breast milk, and then for the rest of our lives, fluid. Just as humans, as we've evolved, we've really enjoyed kind of coffee, pops, teas, those kind of things. The best way to check to see if you're getting the right amount of fluid is to check the color of your urine and the odor of your urine. If it's clear and odorless, you're probably receiving enough water. If it's colored, opaque, has a strong odor to it, likely you're dehydrated. Now, couple of things to consider. Don't count the first thing in the morning, likely because you haven't consumed fluids in anywhere between kind of 6, 8, 10 hours. And then if you're eating strongly flavored foods, sometimes they have an impact on the odor of your urine. So drink when you feel the desire to drink. Drink until you've quenched that thirst. Check the color of your urine. If it is clear and odorless, you're probably getting enough fluids. So just moving a little bit away from those kind of practical pieces, these are more cognitive exercises that may be beneficial for your recovery. What we know is that recovery can be a very tumultuous time for people. As a clinician, one of the things that I do say to my clients is, even though you've changed your substance use for the better, sometimes the other aspects of your life don't immediately get better. We're going to be stressed out. And our brains aren't always our friend very early in the recovery process. Your brain may knock and say, hey, I want drugs for whatever reason. And it can be a very loud voice inside your head. What we encourage you to do is consider writing down the reasons why you're not or why you're making changes. And they can be very simple reasons. I want to get my life on a better path. I want to be healthier. It may be that I'm doing it for my children or my employment or my overall health. But actually having a tangible list, I would encourage you to keep it in your wallet or your purse, so that when those negative messages kind of crop up as a result of some sort of stress or trigger, you have that ability to pull it up and have a look at it. I always share with people, when I worked in a long-term care facility back in the early 2000s, I had a little card printed off with these particular or this particular exercise on one side, and on the flip side I had the payphone number for the agency, the office number for the agency, and a couple of blank phone numbers for support people in life. And I also taped a quarter to the card for our new clients. And part of that was because back then cell phones weren't very common in the dinosaur age, and payphones were only 25 cents. So what it did is it removed the barriers for a person to actually reach out and ask for support and remember the reasons why they're making change. So what we also want to look at is just coping with cravings. This is actually another SIS, and I would encourage you to kind of review that or attend it if and when we get back to in-house services. I'm not 100% sure if they're going to be providing it through the online platform, but I think this is one of the important ones. What you need to understand is that cravings, no matter how strong, will always pass by themselves if we wait long enough. It's often what we do within that time frame of waiting that predicts the outcome. What I'm going to suggest to you is never just sit and try to process where the craving's coming from. It happened for a reason. You may not be aware of it, and it may not be important in that moment. What we encourage you to consider is what we refer to as the 20-minute rule. 20-minute rule is really just, when you experience the craving, commit to engaging in some other activity for at least 20 minutes. And generally your desire to use should dissipate. Also understanding that most cravings for food and water are misunderstood as a drug or alcohol craving. Really, it's our bodies telling our brains that we want something in it, and the brain, unfortunately, wanting to use drugs or alcohol, will say, oh, I got a good idea. So stay hydrated, continue, have good nutrition, and we should be able to reduce those. As a little bit of a story that reinforces that, I share with people the story of the eating an orange. When I was younger, I used to volunteer for the Elkathon on Christmas Eve through AA, and I heard an old timer share, with a newcomer. He said, if you're experiencing cravings, eat an orange. And I didn't think of anything of it at the time, and then probably about 5 years later, I heard it again. So I approached the old timer and I said, can you tell me a little about the orange? And I think it's important to understand that one of the newer tools that we use in recovery is mindfulness practice. And what mindfulness practice is just being in the moment, not getting too far ahead in our future, not dwelling on our past. It's like, what's happening right now and what are you in control of? And so the way he describes eating an orange is very much a mindful practice. He said, well, I want you to consider when you eat an orange. He said, it's never that you just pick it up and start eating it. He said, if you take a whole orange, the first thing you do is you pick it up and you usually use your hands and you give it a squeeze. He said, then the next thing is that you usually hold it up and you smell it. He said, sometimes people scratch the peel and then they hold it up and they smell it. He says, and then what happens is you usually dig in with your thumbs and you tear it open. And he says, you can hear it and you can smell it. And he said, and the act, peeling takes time. And then he said, sometimes you get the peel off. And he said, different people, break their orange down differently. Some people don't like the white pithy material and they pull that off. And he said, but then you eat the orange. And he said, what you need to consider is that eating an orange takes time and it engages most of your senses. And he said that in that time frame, most people will find that their cravings reduce. And he said the other thing too is that it fills you up and it gives you a lot of fluid. So eating an orange covers and encompasses so many aspects of managing cravings, managing the withdrawal process, and in a very small way encompasses what we've talked about today. So last little bit we're going to go through, this is called HALT. HALT is an acronym for what we refer to as antecedents. An antecedent is a trigger, things that trigger us to use or return to our old behaviors. So asking yourself on a regular basis, am I in HALT? Am I hungry, angry, lonely, tired? When we take our time to address these particular antecedents, we continue to reduce our risk. Each of us tends to have triggers that are very subjective. They're very important to each and every one of us. So what and part of the counseling process is being able to identify which ones place us at greater risk than, say, other people. Additionally, we want to encourage you to seek medical attention. On a couple of occasions today, I've said it's best if you talk to a medical professional before you start withdrawing, but the reality is we know that the vast majority of individuals do try to withdraw at home on their own. So what you need to be conscious of are of when to seek medical attention, either by going to the emergency department or local urgent care center. So if you are experiencing vomiting that won't let up or includes blood, if you're experiencing persistent uncontrolled diarrhea that isn't responding necessarily to things like Imodium or Pepto-Bismol, definitely difficulty breathing, shortness of breath or rapid breathing, sudden chest pain or severe abdominal pain. These would all be reasons why you would access a medical professional or an emergency care. Additionally, if you're having or had a seizure, now the reality is, as I said earlier, it's likely that somebody else has told you you've had a seizure, or you're waking up probably very tired, maybe sore, incontinent, and on the floor or in a place you don't remember getting to. Those are really good indicators that you've probably had a seizure. If you are having severe body shakes or chills, confusion, disorientation, and or experiencing hallucinations, hallucinations in the absence of hallucinogens, these are good examples of delirium tremens, which are often tied into seizures. Severe agitation, anxiety, severe headaches, and last but not least, if you have this sense of harming yourself or experiencing suicidal thoughts or planning on how to harm yourself, these are definite reasons to call 911. So, a couple of things to consider. New beginnings are often disguised as painful endings. As I said earlier, sometimes early in the recovery process, things don't immediately get better, but you got to remember that we're building the foundation to be able to work through those difficult pieces. You don't build a house without footings and a foundation. Let's put the foundation in. Be patient with yourself. Believe that you have the ability to do this. Be very easy on yourself. Take it one day at a time, and remember why you want to change. Always reach out for help. It is possible. Thanks, folks. I hope this was beneficial for you. And I would encourage you to follow up by watching the other SISs. Thanks again.